Hey future nurses, this is Courtney with NCLEX Bootcamp, and if you're studying to take your NCLEX, I've got a practice question for you. In this question, we have a client who's struggling with depression, and they're really struggling with self-care tasks like grooming and hygiene. And we're being asked which of the following responses by the nurse would be appropriate. So let's first ask ourselves what we already know about depression. Well, I know that depression is the most common mental health illness, and you're really likely to see it on the NCLEX. But outside of that, I also know that depression causes clients to feel very overwhelmed by most things. So my job as a nurse is to help them accomplish tasks by breaking them down into small and manageable chunks. So let's take a look at our answer options to see how we can best support this client in meeting their self-care needs. Our first option is, do you feel like getting up to take a shower? Well, let's think about this. Clients with depression feel very overwhelmed by basic daily tasks. So this whole process of getting up and taking a shower is likely going to feel very overwhelming, and they're probably just going to tell us no. So we don't necessarily want to give them that option. So let's move on to choice number 2, which is you'll feel better if you get dressed for the day. Well, this is kind of just an unhelpful statement, right? The client knows this, and if they could get up and get dressed for the day, they would. But when depression is really severe, activities of daily living feel really overwhelming. So we need to find an option that helps them accomplish these tasks in a more manageable way. So let's take a look at choice number 3, which is I'll sit with you while you brush your hair. Here's your hairbrush. What do you guys think of this one? I like it, and let me tell you why. I like it that we're offering support by offering to sit with the client while they brush their hair, and we're breaking down the task of getting ready for the day into manageable chunks. We're saying, let's just start with brushing your hair, right? That's going to feel a lot less overwhelming than saying, hey, go take a shower and get ready for the day, right? So I'm liking this option, but just to be sure we didn't miss anything, let's take a look at choice number 4. And that is, you seem overwhelmed. You can brush your teeth when you're feeling ready. What do we think of this? I like the first part that we're acknowledging that they're feeling overwhelmed. That's very important to validate those emotions, but telling them they can brush their teeth when they feel ready is not going to be that helpful, right? Because they're probably just not going to do it. And that is going to perpetuate those symptoms of depression. So I am still liking option number 3 because it supports the client in accomplishing those activities of daily living, but it does so in a way that is supportive and breaks those tasks down into small and manageable chunks. So let's go ahead and check our answer. And yes, we are correct. If you like this practice question, there is so much more where this came from. So I would like to invite you to join me for our next NCLEX webinar. I'm going to take you onto our live site at bootcamp.com and show you everything we have to offer. I'm going to show you our study schedules, our question bank, and of course, our next generation case studies. Bootcamp has everything you need to be successful on the NCLEX. So take a look at the information below for when you can attend that webinar, invite your friends, and I can't wait to see you there.